Hi, I'm Holly from Flow Movement Therapy, and I help you, empower you to get you back to the active body that you want by helping you move better. And today we're going to be talking about your jaw. We want to know what your jaw is supposed to do so that we can give you exercises to help you move better without pain, rather than being frustrated with all the things going on with your jaw. So we're going to talk a little bit about what the jaw does and how to get your jaw and your skull moving the way we want to try to alleviate some of that pain. Now, our jaw is a dangling joint, so that bone is dangling off your skull, and so it is influenced by gravity as well as what your skull is doing. So today we're going to work on the movements of your jaw relative to your skull to help you get back the movements that are going to help alleviate pain. So you may want to try along with the mirror in front of you later so that you can start noticing these things about your body that maybe you had no idea were happening because you don't know they're happening. So we want you to start observing those things. Before we get started, I want to make sure that I'm making content that you guys like. So make sure you hit that subscribe button so that you get the content that I drop whenever I do. And make sure you press the like button so that I know that you liked the content. Let's get on with our exercises. First, what we're going to do is we're going to work on the movements going forward and back. So we're going to focus one plane at a time. We're going to focus on what your skull is doing and then what your jaw is doing along with that. So just like I said, the jaw is a dangling bone, so it is influenced by gravity. So we want to allow it to move as it's meant to with gravity. So when you tilt your head up, so you're looking up towards the ceiling, tilting your head backwards, gravity and the joints here against your skull will cause your jaw to fall back and into your skull. So it's hard for me to talk and demonstrate at the same time, but what we're going to do is you're going to be looking up and letting your jaw fall back and down into your skull. So just practicing that looking up, letting your mouth open, and letting your jaw fall backwards into your skull as you look up. So that may be unusual for you, or it may be unusual to do that equally on both sides. So again, check in a mirror. Is your jaw falling backwards? Now, when we do the opposite, when we tilt our skull forward, we want our jaw to come down and forward. So as our skull goes down, that dangling bone is going to use gravity to go down and forward. So that's going to look like this. So a weird way, something looks pretty weird, but again, mechanics, we want to get that moving in the right direction. So as my skull tips forward, as I think about getting long in the back of my neck, I'm going to let my jaw fall down and forward as I do that. Now, if that's unusual for you, you may want to take some fingers right underneath your ear. You're going to find where there's sort of a right angle almost here at the back of your jaw, so right underneath your ears. You want to encourage that with your fingers gently down and forward as your head nods forward, letting your jaw go down and forward. So you're going to think of your teeth, your bottom teeth coming forward of your front teeth. And clearly that's what I need to practice too. So that's our going forward and back, letting your jaw dangle. It's going to go down and forward as your head nods forward, fall back and in as your head nods up. Now we're going to do our side-to-side motions. I want to try to keep your nose right in the center here, so we're not doing this kind of side bend. We're just keeping our side bend nice and tight. And so what we want to do is, again, with that dangling bone, if it's going to dangle with gravity and you're going to take your skull to my right, then it's going to stay behind. So as it's dangling, it's going to stay behind. So you're going to feel like your jaw is going left as your skull is going right. So let's try that together. As I bend my neck, my skull to the right, encouraging my jaw to go left. And trying to keep your nose in the middle so we're not doing these big side bends. And then when I go to the left with my skull, my jaw will go to the right. And so just practicing going back and forth. Encouraging your jaw to go in opposition to your skull. And in our last plane of motion, that's our rotations, we also want our jaw to dangle, so it's going to stay behind as we go. So as I look to the right, as I look to the right, my jaw is going to stay a little bit more facing forward than my skull. And then when I rotate to the left, my jaw will be staying behind more to the right than my skull. And just back and forth. And so practicing each of those is going to help you bring back the motions of your jaw relative to your skull, hopefully alleviating some of the pain that you have in your jaw, the clenching, some of the things going on at night in there. So practice each of these, again, in front of a mirror. Make sure you can see what's going on because you may not be able to feel it. And then just give that a go and see how you do. If you want help with more of these sorts of things in your body, with your jaw, your skull, or any other parts, you can book a free 30-minute session with me. The link to do so will be in the description below. Thanks for joining. Thanks for watching all the way to the end. That means you guys like this video. So if that's true, hit the like button so that I know to make more of it in the future. And if you want to never miss out on what I put up on my channel, hit the subscribe button and I'll keep making content for you.